how are you today? Good to see you again. All right, so I've got good news for you. After looking at your examination and the x-rays that we did yesterday, I feel confident that what you have is a chiropractic problem. So, since what you have is treatable with chiropractic care, I want to go over a couple of highlights about what is chiropractic. Number one, it's been around for 150 years, so had it not worked so well, it would have disappeared a long time ago. And in fact, the opposite is true. We're now the number one health choice, alternative health choice in the world. And there was a study done by WebMD on millions of people, and they found that there was a 95% satisfaction rate when chiropractic was used. So I'm extremely confident we can help you, or I wouldn't accept you as a patient. Now, the million-dollar question, why do you feel the way that you do? What I want you to understand is that this is the accumulation of trauma through your entire lifetime, possibly dating back as early as birth until now. So what I mean by that is it wasn't one twist, one turn, one car accident. It's the accumulation of things, and then when you bent over and picked up your newspaper yesterday, that was the straw that broke the camel's back. And so your body has 740 trillion nerves in it, and only a third of them have pain fibers in them. So by the time you have your back pain, you've got lots of things going on, including possibly decreased function. So I care both about your pain and your decreased function. But dating back to, you add into, you have babies, young babies, and you've seen how they trip and fall, and then you add your teenage years, car accidents, sports, and then the adulthood stresses, and bending wrong and lifting wrong and different activities that we do every day. So, and you haven't had any chiropractic care, so really the onset of your pain yesterday was without any prevention. You haven't done anything to offset that your entire lifetime. So you have nerve damage. You can't have pain without nerves, and I just mentioned how many nerves are in your body. Literally every cell is controlled by the nerves. As a protective mechanism, your muscles have shortened up and formed what we call a muscle spasm. You have some tissue damage, which I'm going to show you on the x-ray in your pelvis and your low back. You don't have any permanent spinal wear and tear yet, which is extremely exciting, but it's also important to know because that means we can help you 100%. If we wait 10, 15 years, I don't know if that's going to be the case. And you do have decreased range of motion in your low back. Okay? So those are the things that we need to fix and treat in order for you to feel 100%. The clinical term for what we do is treat subluxations. A subluxation is when joints don't move correctly and it causes irritation or pinching on the nerve. Wherever that nerve travels is going to be affected. So it'd be like if you were watering your garden and you got a kink in the hose, what would happen to the water?
It couldn't come out.
It wouldn't come out. And that's what's happening. The messaging from your brain's not getting through that nerve to your body. And that subluxation is the reason why you're having that back pain. So we grade the degeneration process in phases, just like heart disease or cancer, something you might be more familiar with. The further we go in these phases of care, the harder you are to treat. And sometimes phase 4 is even a surgical patient. So the good news is that I have you between phase 1 and phase 2, meaning you don't have any permanent degeneration, but you are misaligned. So we want to move you back towards phase 1 as quickly as possible. So let me show you your x-rays, show x-rays, and then do you have any questions? So after so Mandy, since you're not able to take the x-rays home, I'm going to mark on here exactly where your problem is so you can share it with your husband. Any questions about your x-rays, what's wrong, or what's wrong? Okay, so now the solution to your problem is chiropractic adjustments. That's where I'm going to take a contact on your spine with my hand. You're going to feel a pressure and then a light push. And what I'm going to do is start to manipulate or line up your segments so that you don't have pressure on that nerve anymore. And just like you didn't get this way in a day, I'm not going to fix you in a day either. And so what I've done is I've divided up your treatment plan into 3 main phases. The first one is pain relief, the second one is stabilization, and the third one is maintenance. So what my goal in stage 1 is to get you out of pain as quickly as possible. Now since you're young, you're healthy, and you don't have any permanent degeneration, I believe that I can probably get that done on 3 times a week for about 4 weeks. The reason I want to see you 3 times a week is because these adjustments are going to build one on top of the other. So when I see you, I want to see you within 48 hours so that we don't take 3 steps forward and then 3 steps back. I want to see you, every time I adjust you and realign you, your body's going to try to revert back to where it is now. So I need to see you so we can keep making progress, okay? It's my belief at the end of this you'll have an 80% reduction in your pain, and then we'll move into phase 2. Phase 2 is stabilization. We'll add in exercise, strengthening things for you to do at home. The stronger we can get that, we can prevent the problem from reoccurring. And then we're going to move you to maintenance. Maintenance is going to start once a week. Did I go over? I forgot that part. So we're going to do 2 times a week for 2 weeks for stabilization. After that, I'm going to start you on maintenance. We're going to do once a week for 4 weeks, and then we'll space you out from there until, you know, we've got you on a good maintenance plan. Because the one thing I can't change, Mandy, is everything you did to get yourself in this situation in the first place. So I'm not going to change the fact that you're holding a 2-year-old all the time. I'm not going to change the fact that you're sitting at a desk 8 hours a day. And so what I'd like to do is set up a situation where we're seeing you regularly but infrequently to avoid these things. A lot of our patients choose monthly. Sometimes you might need a little bit more, or we might be able to space you out a little longer than that. So we will do evaluations every 6 visits. If you're doing extremely well, we'll decrease the frequency of your care earlier. And if you're not where I expect you to be, then we'll either change up the treatment or get done what we need to do to see the results, okay? Outside of your chiropractic care, I have 2 responsibilities for you. One is keep your appointments, because I can't help you unless you're here. And the second is we do a free 15-minute class called How to Stay Young Your First 100 Years. We find that patients that come and get educated during that class have a lot shorter treatment plan than those who don't, because you know how to live outside of here. So we offer that Wednesday at 12:30 and Thursdays at 6:30. Which one of those works better for you?
Wednesday.
Awesome. Any questions about your treatment plan?
No.
You ready to get started?
Yes.
Good deal.